Good afternoon, and welcome to our 30-minute talk segment, Give 'em Health with GHF. This month's topic is a continued conversation from last month, where we talked about Pride Month and we also talked about Men's Health Awareness Month. Today we have with us Dr. Avon Sims. He will be talking to us from an educator's perspective on the things that the school system are doing in order to create safe spaces for trans-identifying youth. Welcome, Dr. Sims.
Thank you.
Pride, this topic was such a big topic, and we had so much information that we had to actually put this into a two-part talking series. So this is the second series of this conversation, continued from last month. So thank you for joining us. Last month, we talked about Pride and the history of Pride, how it came about, and the purpose of people now celebrating every month in different cities and different states. Also, we talked about men's health, the importance of making sure that you see your healthcare providers. And we really wanted to dispel some of the myths that men have as it relates to going to the doctor. So those are the topics that we'll be speaking on today, Dr. Sims. At this time, I would like to welcome you, and I would like to give you the opportunity to introduce yourself and tell us a little about you professionally and personally. Welcome.
Thank you. I want to begin by saying thank you for this opportunity to speak on these matters. These matters are near and dear to my heart. I am an individual that lives in Georgia um, and have been employed by various school districts within the state over the past 20 years. This upcoming year begins my 20th year in education as a certified educator. I have worked in various roles, such as science teacher, department chairperson, administrator for a 10th grade class, also a district-wide instructional facilitator, which is otherwise known as a coach for teachers. I currently operate in the role of a multi-tiered support team specialist. And so what that basically consists of as serving as a support for students. Um, in my last few years working in this capacity, I've encountered several students that are questioning and or identifying um, in different ways from a gender perspective as well as a sexuality perspective. So I do believe that talking about this topic or these topics in 2022 is very timely and it's necessary. Um, our youth are very they need to be educated as well as they needed to be guided as we go along this path of older adults being able to learn what it means to identify in one of the ways LGBTQI plus and what that means to younger adults and it's basically time for this conversation to happen.
Thank you for that. So, when we first started this conversation last month, one of the main questions that people asked was, why have a conversation about pride? And it's quite simple. I myself, as an identifying active community member of the LGBTQIA plus community, I would love to have an opportunity to talk about myself, what it means to be an identifying gay man, some of the struggles that we face, but also some of the successes and what it means to be prideful about who you are. So, having this type of conversation begins to open up the door and the window for many more conversations amongst many other communities and many populations. And what we want to do is just start the conversation.
I
So,
agree. Yes.
thank you. So I brought you on because right now it seems as if people are beginning to transition quite frequently. The world is changing and it looks so many different ways. And we want to make sure that we embrace difference. As an educator, You all are teaching our young minds to be the bright stars of tomorrow. In addition to education, you guys have to combat and deal with so many social issues. So, as an educator, could you just tell us a little bit about some of the processes, some of the conversations, maybe that the faculty have had in reference to trying to create safe spaces for LGBTQIA plus students, but more specifically, creating safe spaces for trans identifying youth? If you guys have had those conversations.
Okay, so as I speak, I'm going to speak about my experiences in two specific counties. Um, this the experiences may not be the same all over, America, but I would like to say that our schools have addressed um, this topic as we've encountered individuals that have been enrolled in our schools. So, what that looks like as professional development has happened in faculty meetings where someone, usually from the social work, in a social work position, will address the faculty about, I'm going to say exactly where we are in terms of laws and providing safe spaces for members of the community, as well as what the districts want us to put in place when it comes to talking to parents about this topic. As you can imagine, this is a very sensitive topic, and you do have to go about it in an appropriate way that the district, supports. So, to be a little more specific, there have been a couple of students that identified as trans, and the social worker had a conversation with the parent just to make sure that there was dialogue between parent and child about where they stand when it came to gender identity. And so, what the next step was for the social worker to involve the MTSS team. And remember, I said that was the multi-tiered system of support. This consists of various members of the staff, teachers, administrators, um, social workers. You have behavior interventionists. All of those individuals meet as a team on a weekly basis to discuss different issues that students have. So, like I said, the conversation begins with the social worker and the parent, and then the next conversation it happens between the student and the social worker. So we establish like a safe place for that student to dialogue with the social worker to say exactly where he or she is, he, she, or they is when it comes to gender identity. And then from that, the MTSS team talks about the systems of support that we could provide for the student from an academic standpoint as well as a social standpoint. One of the first things that has to have conversation about is if the student is a trans student, making sure that person has a place to go use the restroom. So in some
Hmm.
schools, there are non-gender specific restrooms that are designated for those individuals so that that way that they feel safe. And what that looks like and where that restroom is located depends on the actual school. So the school determines, that gender non-specific place.
Okay, that's a great start. As we're having this conversation, just makes me think of certain things. Things that we normally don't think of in our everyday lives. So, as you guys are trying to create safe spaces, what types of conversations did the team have in reference to respecting students by even using their preferred pronouns?
Okay, oh, good comment. So basically, the MTSS team is a grade level specific team. So one day we may talk about the ninth graders, the next day 10th, 11th graders,
Okay.
and 12th, and so on. And so we will speak about that person's where they identify, and then we reference where we're told about what those designated pronouns should be. And from that, those teachers that are on that team, which are specific to those students that are on the call, I mean, the team members that are on the call, we talk about each student. And so from that, we have the dialogue. So all the teachers that are quote unquote tied to that student or have that student in a class, they will be abreast of what those designated pronouns are. Um, and believe it or not, the kids actually have no problem with, well, in my experience, the kids have no problem with accepting what the pronouns are. It's the older adults that are having to make the adjustment.
Mm.
Um, so we have to be conscientious. We have to make sure that the dialogue between the adults is a transparent place and a place that we can have growth.
Okay, thank you for that. And as I stated earlier off camera, this is a relaxed conversation. We really just wanted to have a talk and just talk about some things and get some information out so we can relax. It doesn't have to be really formal. And this is just like a conversation between two friends. The reason that I wanted to invite you on as we talk about pride is because dealing with the youth, the suicide rates among youth, young LGBTQIA plus um, individuals is really, really high these days. And it has a lot to do with many contributing factors, whether it's depression, whether it's isolation, whether it's not being accepted by families. So, as we're talking about pride, we want to begin to get individuals as young as they identify and begin to give them that necessary level of support that they need. And GHF, we are an organization that amplifies the voice of the community. And as it relates to pride, I know that there are many health concerns that many people in the community have, and they want better health care, they want better access, but more importantly, they want providers who are sensitive to their cultural needs, who respect the use of pronouns, who understand their specific medical needs. And so that's why we're having these types of conversations. So again, thank you for coming once more. And so let's relax a little bit. We're also talking about Men's Health Month. As a male, and is it safe to say over 30?
32, yes.
Okay. When did your health become paramount or become very important to you? Yeah, when did your health become very important to
So I'd like to say, actually, I'm 47 years old. So um, I became a little more serious once I became 40
you? Okay.
because I've always viewed 40 as a huge milestone. I did notice within myself that my metabolism slowed drastically around 40, 41. And so,
Okay.
because of that, I began to have conversations with my provider about things that I could do to try to trim my waistline as well as increase my metabolism. And so, that's the answer to that question. But I'd like to also say that that was a turning point for me because I felt that I could be very transparent with my provider, and that's some advice that I would like to give all men as they speak with their providers, because it's very important to make sure that that dialogue is genuine and true, so that way your provider can give you the correct advice about what to do. For example, there are some supplements that I was taking along with high blood pressure medicine that I'm on. And I mentioned that I was taking these supplements, but I didn't mention exactly when I was taking those supplements. So I've learned in the last year that just being open about that can talk about it could help you address drug interactions, whether or not those drugs are working better if you take the supplements several hours before or after specific medications, or if you can take them simultaneously. Um, so that was a big lesson that I've learned because I've been thinking something was helping me, and it actually was not
Hmm.
a best practice for me.
Okay. So we're at a certain age now where we're having to take certain screenings for prostate cancer, um, screenings for making sure that our hearts are healthy, colon cancer screenings. So for me, I too am over 40. Once I turned 40, I realized that I was getting older and our bodies don't always work the way that they used to when we were younger. So at 40, health became very important to me, especially as I was having conversations with my provider and they're preparing me to have colonoscopies and preparing me to have prostate screenings. I realized that I must take my health serious because there are some preventative things that I can do in order to remain healthy. And I want to stay here on earth as healthy as I possibly can and as long as
Right.
I
Yeah.
can. So
Hmm.
that's why it became important to me. And I think sometimes men, for some whatever reasons, don't want to go to their providers, don't want to be seen, don't want to be screened. And we have to now start to have those conversations of why it's important and the benefits of seeing our providers. So having those colonoscopies and having those um, prostate screenings helps us to have early detection and we can do some things in order to remain healthy. So it's very important that we as men start to have these types of conversations. Uh,
So you just made me think about my experience at 40 doing my annual exam. So I remember my doctor saying, "Hey, it's time for the prostate exam." And so
mhm.
I like to say for all gentlemen that are listening, it's not as bad as you would probably think it would be. It's very quick, and it could be the telltale. It's early detection, like you said. Different things. One thing to think about is your PSA levels. Um, I had just be a little transparent. I had a little scare because my level was up, and so it made me automatically think, "Hey, oh my God, I have prostate cancer." But that did not mean that it was something. My levels actually leveled back out, but it gave me an opportunity to be educated by my provider about what the screening is, what PSA levels are, um, what early detection means, and what route you will have to go should the levels consistently be up to indicate that there may be some prostate cancer in the body. Um, and you just mentioned colonoscopies. It made me think about. I want to say I was 43, and I was having some dietary issues, and it made me wonder if I was having some issues going on with my colon. Um, and it's good to know, like for someone that has health insurance, providers when I don't know if it's provider is the right word. Those that provide the approval for you to have the colonoscopy, they don't give it to you unless you're 45 or if you are at a high risk for having colon cancer. So that's something important for a gentleman to know, actually anyone to know. Um, the age used to be 50 where you could get the colonoscopy paid for, but now it's actually been lowered to 45. However, it could be given earlier should there be some suspect of issues going on in the colon
Okay,
area
thanks for
with
that.
the colon.
So this is where I always get tripped up. These are only 30-minute conversations and they can go really quickly. Just talking about one topic, we can go on, and before you know it, we've surpassed the time. So I want to stay as true to the time as possible. And by doing that, I just want to recap the things that we've talked about. So today we got together to talk about pride and also men's health, specifically what the school systems are doing to create safe spaces for trans identifying youth, as well as the entire LGBTQIA plus community. Um, and how this is having a positive impact and effect on the youth because they are being seen, they feel heard, and when you validate someone, then it goes a long way. So Thank you all for being progressive in your thinking, trying to be inclusive, and trying to think outside the box. As it relates to men's health, we both are men over 40. It's time for various screenings. And what we want to do is really, really just ask men to don't be afraid to go to the doctor. Don't be afraid to get certain health screenings. Don't be afraid to take an active part in your life and living.
Mhm.
And so many things can be caught early. So many things can be alleviated just by us doing those simple preventative things by going to our doctors and getting those screenings. Is there anything else that you would like to say to any men out there or any trans identifying youth, any young LGBTQIA plus individuals, anything you would like to say?
Yes. So speaking to students, individuals that are trans and members of the LGBTQIA plus community, there are resources that are out there that you could tap into, so that you can have a shoulder to lean on, to talk to, just so that you can get various needs met. So in the instance that you may be um, not at the home that you were raised in and you've been quote unquote kicked out,
Mhm.
you can find housing, um, access to health resources. One of them, in my learning more about how to provide support, is the GLSEN um, network. It stands for Gay, Lesbian, Straight Education Network. And there are
Okay.
various entities throughout the nation that provide resources to individuals within the population. And it's a consortium of resources where individuals could, benefit from. There's also the American Psychological Association. And then there are lots of resources that are within the metropolitan Atlanta area. In regards to men's health, I like to say, men, we need to take charge of our health. We only get one opportunity to live this life. And even though, the lifespan has expanded beyond, 60 years, um, we have an opportunity to make the best of it by making sure that we're receiving treatment, making sure that we're open and honest with our providers, making sure that we're taking charge of healthy and active lifestyles, making sure that we involve ourselves with like-minded people who are wanting to make adjustments to their lifestyles, where needed. So my my last thing would be to say, men, go out there and be checked. Get
Right.
your
Go to
check
the
on.
doctor.
Yes.
So,
Go to
in
the
wrapping
doctor.
this up, I just want to remind people that right now we have what we call a special enrollment period. And usually insurance opens around November. Open enrollment opens in November. And that's when, if you don't have insurance, you apply to qualify for insurance. Right now, we have what we call a special enrollment period. So that means you don't have to wait until open enrollment in November. If you qualify for the special enrollment period, you can go ahead and apply for insurance now. There are some specific requirements. So, what I would urge and encourage anyone to do, if you feel that you want insurance and you may qualify for a special enrollment period, or you just want to find out information on the special enrollment period and what that looks like, then I urge you to give me a phone call or shoot me an email, actually. And my email is tcooley at healthyfuturega.org. Shoot me an email, ask your questions, and I can answer them for you. But more importantly, I can help you get registered during the special enrollment period if you qualify, or we can go ahead and schedule to have you come back during open enrollment in November, and I can schedule a time with you to talk with you and go through your application and help you get approved for insurance then. It's very important that we understand that we have insurance options out here. Every Georgian should be covered. That is our mission here at GHF. So we want to get the information out to you. And if you're not covered, we want to make sure that we can get you an opportunity to get some insurance coverage so you can get your physical um, screenings, so you can get your mental health uh, appointments, and so you can live your best life and be your best self. So again, thank you, Dr. Sims, for coming on and talking to us about the school system's approach. And we appreciate you all for being innovative and thinking outside the box, and also sharing some of your personal testimonies about health and why it's important to you. So again, thank you, and I appreciate you, and I hope that we can have you back sometime.
All right, thanks again for this opportunity. I hope that something I've said will benefit someone out there. So thank you again.
All right, thank you, and have a great one.
All right.